الله الرحمن الرحيم. This is the 50 case of pediatric imaging spot cases, and I will give some seconds and try to answer, and I will answer each case after the presentation. This is one. Second, there is a certificate attendance after attending the cases, and you can fill the link, and it is present in the YouTube, and I will also put it on the Facebook, and fill the required fields, your name and email, and you receive the certificate within minutes. الحمد لله والصلاة والسلام على رسول الله. الحمد لله. والصلاة والسلام على رسول الله. الحمد لله الذي هدانا لهذا وما كنا لنهتدي لولا أن هداني الله. اللهم انفعني بما علمتني وعلمني بما ينفعني وزدني علما إنك العليم الحكيم. اللهم أخرجنا من ظلمات الوهم وأكرمنا بنور الفهم وافتح علينا بمعرفة العلم وسهل أخلاقنا بالحلم. اللهم ارزقني نعمة الإخلاص لوجهك الكريم بكل ما أقول وبكل ما أفعل. آمين يا رب العالمين. This is pediatric imaging spot cases. We have 51 spot cases. This is the case number one. Try to look at the case and try to answer the case. This is ultrasound of both kidneys and lung axis, and we see that there is medullary echogenicity involving both kidneys consistent with nephrocalcinosis, and also we see hydronephrotic changes involving the right side consistent with the uretropelvic obstruction or hydronephrosis, whatever the cause. Next case, we have, this is a brain MRI T2, and try to look at the case. What do you think it is? As we see here, this is a schizencephaly, and this schizencephaly, this is the closed lip schizencephaly, and we have the gray matter surrounding the schizencephaly close the lip, and it is should be differentiated from boring-cephalic cyst, because in the boring-cephalic cyst, the surrounding the cyst is white matter, not the gray matter. So this is a schizencephaly closed lip. Here, look at the case and try to answer. What do you think? This patient, a neonate with respiratory distress. Here we have congenital diaphragmatic hernia on the left side, and most probably it is a apodelic type hernia. Next case, this patient with try to look at the case and try to answer. What do you think? We have, this is axial cut, and this is corona reconstructed images or reformat images. We have calcification in the left eye consistent with retinoblastoma, and we have cystic lesion in the right side temporal region in keeping with arachnoid cyst. Next case, we have this patient with some respiratory distress. What do you think about this case? This patient has on the right lower zone multiple cysts, large cyst, and this is raising the possibility of congenital cystic adenomatous malformation type 1. This is congenital cystic adenomatous malformation, or the new name is congenital pulmonary congenital cystic pulmonary malformation, CBAM or CCAM. Next case, this patient with presented with what is the presentation of think of this patient? Okay, we have stridor, if the patient presented with stridor, and we have subglottic narrowing and over distension of the hypopharynx. And this is a classic case of a group. We move to the next case. This is an MRI patient, pediatric patient. What do you think of this patient has? We have lesion in the tibial epiphysis here, and this is T1, this is FATSAT, and this is contrast study with FATSAT, and this is a chondroblastoma. It is an epiphyseal lesion. Next case, this patient with respiratory distress. What do you think the patient has? We have over inflation of the left upper lobe with some compression of the left lingular and lower lobe, and also there is crossing the midline to the right side with shifting of the mediastinum. Findings are consistent with congenital lobar overinflation. This is the new name. Also, they call it before congenital lobar emphysema. Okay, this is a new case. This patient also presented with respiratory distress. What do you think the patient has? We have the CT scan, scout, and we have the CT scan and coronal, axial, and 3D. Okay, the patient has congenital cystic adenomatous malformation or CBAM. We see multiple cysts, large cyst involving the left kidney and consistent with type 1. We move to the next case. This patient is a child presented with some respiratory problem, and we did the CT scan, and the CT scan, it shows mass in the left lung, and the mass have necrotic and soft tissue component, and have also some enhancement. And this is, we should raise the possibility of a pulmonary blastoma. And this is also one of the differential diagnosis of CCAM or CBAM. Here, this is another patient, 10-month-old boy. And what do you think about this patient? We have, as we see here, we have bilateral renal masses, and this is the closine here, and this is the closine here, and these are renal masses bilateral, and the age, it is 10 months, and it is bilateral renal tumor. Here, this patient, child, what do you think? We have abnormality in the middle finger. What do you think of this patient has? The patient has, as we see, there is discrepancy between the middle fingers and the rest of the fingers, and it is enlarged middle finger, the soft tissue and the bone, and it is consistent with macrodystrophia lipomatosa. Macro dystrophia lipomatosa. This patient presented with jaundice 3 months and elevated direct bilirubin. What do you think the patient has? The patient is on phenobarbital for 1 week. Here, this patient has biliary atresia. As we see here, the liver is homogeneously take the uptake, and there is no intestinal uptake with this patient, even after 4 hours and 24 hours. So this is a classic case of biliary atresia. What do you think of this patient has? Patient has 15 years old and has history of osteogenesis imperfecta. What do you think the patient has? The patient has treated with biphosphonate, and biphosphonate therapy giving the appearance of zebra lines, as we see here in distal radius and distal ulna. Okay, this is a biphosphonate therapy in pediatric, and the same we see it also in adult. This patient has, what do you think? The patient has, this is a child with left-sided CDH, as we see here. The left hip is displaced laterally with dysplastic changes on the left acetabular, and we have absent sacrum here, and also the patient has spina bifida occulta. What do you think the patient has? This patient is immature patient. What do you think? We have congenital anomaly, and look at the congenital anomaly. We have here the lunate, and here the visiform, and here the triquetrum. So we have correlation between lunate and triquetrum. What do you think the patient has? This is a new patient, has pain in the right hip. What do you think the patient has? And we see here the patient has classic, this is a classic case, slipped capital femoral epiphysis, slipped capital femoral epiphysis. What do you think the patient has? This is teenager with wrist pain after trauma outstretched hand. What do you think? We have distal radial fracture and dorsal displacement and dorsal angulation, and this is a classic case of Colles fracture. You see the soft tissue around the wrist and the fracture and dorsal displacement. This patient, what do you think has this patient? This is patient with respiratory distress. What do you think? As we see here, the patient has multiple pathologies. We have hyaline membrane disease involving both lungs with the granularity, fine granularity or glass appearance. And also we have the endotracheal tube on the right side, and also the patient on assisted ventilation. And we have also a pneumopericardium. With the pneumopericardium, it is not ascending above the aortic arch or pulmonary artery. So this is classic pneumoperitoneum, not pneumomediastinum. This patient, what do you think the patient has? We have the patient has chronic osteomyelitis with periosseous reaction. We see the patient, the ulna is thick cortex with periosseous reaction and soft tissue swelling, and this is consistent with chronic osteomyelitis. Okay, what do you think the patient has? This is patient has, you should think of systemic disease. What do you think? Okay, you have lucent metaphyseal lines, as we see here, lucent metaphyseal line, and it can be seen in normal, but it is the diagnosis leukemia or neuroblastoma or infection. So this is a leukemic patient with metaphyseal lucent line. Also, we have the dense metaphyseal lines and also can be normal. And this is a patient with lead poisoning. This is lead poisoning. Also can be seen in leukemia and hearing rickets. Here, this is ultrasound of a pregnant lady, and this is the head, and we see small cyst, sorry. And what do you think about this small cyst? And this is a classic choroid abductus cyst, and this is a choroid abductus cyst, about 6.5 millimeter. Here, this patient with umbilical venous catheter, as we see, the normal umbilicus venous catheter should be at the level of T9, T8, T9, and here it is passing the IVC, passing foramen ovale and going to the left ventricle. As we see here, this is the should be the level of umbilicus venous catheter, here to the IVC, foramen ovale, and left ventricle, and abnormal position of umbilicus venous catheter. Here, this patient with trauma, what do you think about this patient? Here we see epiphyseal fracture, and this is a classic Salter-Harris type 3 epiphyseal fracture. Salter-Harris type 3 epiphyseal fracture. Salter epiphysis, A above, it is metaphyseal fracture. L low, it is epiphyseal fracture. T, it is both above and below, and metaphyseal and epiphyseal. And E, it is renewed, the epiphysis and type 5. Here, this is a case of periosteal reaction involving the forearm, and this is a case of Caffey's disease, periosteal reaction. Next case, we have this patient. What do you think the patient has? We have polydactyly, and the polydactyly in the at the site of the thumb, and it is called periaxial polydactyly, and it is called a periaxial polydactyly. Okay, we move to the next case, and the next case, it is simple, and we should have screening with ultrasound to the old patient, and as we see here, bilateral developmental dislocation or dysplasia of both hip bilaterally. Here we see bilateral displacement of femoral, both femur. Developmental dislocation or dysplasia of the hip. Here we see there is a fracture below and there is a fracture above. As we said, T, it is for both, and this is type 4, Salter-Harris epiphyseal fracture. Okay, this patient, you should know this patient, and you should not mistake with other disease, and this is the patient has Perthes disease. This is a Perthes disease involving the right hip, fragmentation, sclerosis, and widening of the neck. This patient with what do you think? With this patient has 14 years with a neurodevelopmental delay. What do you think? We have a dilatation of the ventricles and bilateral symmetrical calcification on the periventricular region. And this is a classic case of congenital cytomegalovirus infection. Congenital cytomegalovirus infection. Here, this patient, what do you think about this patient? It is 22 months old. What do you think? This is a case of vitamin D deficiency or rickets. We see fraying, widening of the metaphysis, fraying and covering and involving the ankle and involving around the knee. And widening also of the epiphyseal plate. So this is rickets or vitamin D deficiency. We move to the next case. What do you think about the next case? The patient has vomiting and poor weight gaining. And we see here the patient has a lucent area in the second part of duodenum extended to the third part of duodenum. This is a diverticulum surrounding by lucent area. And this is a congenital whip. This is a duodenal whip. And as we see, this is the lucent area and this is the whip. Can you remember the sign of this whip? What do you think the patient has? We have this patient has foreign body in the upper esophagus, and it is a coin. And this patient, what do you think the patient has? This patient is 9 years, female. What do you think the patient has? We have periosteal reaction, onion-like periosteal reaction, and this is a case of Ewing sarcoma. What do you think the patient has? This patient is about 4 months with abnormal head shape. What do you think the patient has? Here we have the coronal suture open, lambdoid suture open, and the metabolic suture, as we see here, it is closed. And this is craniosynostosis of the metabolic suture. Craniosynostosis of the metabolic suture. What do you think the patient has? This is 3 days child, neonate, with abdominal distension. And as we see here, there is a distension of the bowel seen in the here and there and there. And we did the barium enema, and there is no barium reaching the distal colon. And this is the patient has distal bowel obstruction, and with the barium enema, it is a colonic atresia. What do you think the patient has? This is 16 years old patient with after playing soccer. What do you think the patient has? We have a vulgin fracture. here from anterior inferior iliac spine. Which muscle is attached here? It is rectus femoris muscle. Rectus femoris and anterior inferior iliac spine avulsion fracture. This is a case of bilateral proximal femoral deficiency or defect, as we see here, and you should read the types of the proximal femoral defect and which type is included in this patient. Here, this patient, what the patient has, we have this patient has multiple repeated trauma, microtrauma, and we have this ossification or calcification of the patellar tendon, and this is called sending Lawson-Johnson syndrome, Lawson-Johnson syndrome. And this patient, what do you think the patient has? This patient has thanatophoric dwarfism. Thanatophoric dwarfism. And this patient, what do you think the patient has? This is patient has, as we see here, the interstitial pulmonary emphysema involving the right lung with some hyperinflation of the left lung. And this is one of the complications of ventilation assisted therapy. Okay, what do you think this patient has? We have multiple views and we have V-shape, rhizomelic, and decrease the diameter of the spinal canal if we move distally. And this is a case of achondroplasia. What do you think the patient has? This patient of the abdomen and the region of the pelvis at the region of the urinary bladder. We see mass lesion posterior to the bladder, superior to the rectum, with infiltrating the bladder, and this is rhabdomyosarcoma of the patient. This patient has constipation, and what do you think the patient has? We have narrowing here, and this is a classic case of Hirschsprung's disease. What do you think the patient has? This is a child, immature skeleton, and we have some calcification in the soft tissue away from the bone, and this is a myositis ossificans. This is a myositis ossificans. Next case, patient with chest X-ray. What do you think the patient has? We have the endotracheal tube on the right side, and it is crossing the right upper lobe of bronchus. So the right upper lobe, it is collapsed. Left lung, it is collapsed because the tube, it is in the intermediate bronchus, and hyperinflation of the rest of the right lung. So this is malposition of the endotracheal tube, and this is normal position of the NG tube. And what do you think the patient has? This patient has with the stridor, and has, you see here, the left pulmonary artery is arising from the right pulmonary artery. We call it pulmonary sling or aberrant left pulmonary artery. And it is can cause tracheal compression, esophageal compression, or left bronchial compression. What do you think the patient has with vomiting? And as we see here, this is Barium study. This patient has mid-gut volvulus with malrotation, and this is the malrotation, and we see the corkscrew sign involved here in the duodenum and upper jejunum, and you see the gastroduodenal junction, sorry, duodenojejunal junction on the right side, not on the left side. So this is malrotation with mid-gut volvulus malrotation. Here, next case is cardiac case. We see this patient has big heart, and this is the box-shaped heart, and this is a classic of Epstein anomaly. And the next case, we have the patient with tetralogy of Fallot's. We see the right aorta here, right-sided aortic arch, and pulmonary concavity, pulmonary atresia or pulmonary stenosis, and the right ventricle is boot-shaped, and the apex is elevated. And this is a tetralogy of Fallot. The last case, we have the patient transposition of great arteries, and this is the sign egg on string sign. Thank you for listening, and hoping to see you soon in another talk. سبحانك اللهم وبحمدك أستغفرك أشهد أن لا إله إلا أنت أستغفرك وأتوب إليك. Also, as I said in the beginning, we have certificate attendance and YouTube, and I will put it on the Facebook. Don't forget to fill the form, and you receive the certificate within minutes. Thank you very much for listening.